everyone, thanks for tuning in. My name is Rebecca Parma. I'm the Legislative Director for Texas Right to Life, and today is Sine Die. It's the last day of session. So I wanted to give you a quick summary on what happened to the pro-life policies and priorities this session. Texas lawmakers ignored preborn children in this first session after Roe, yet improved protections for vulnerable patients. So I want to break that down a little bit, right? This was a unique moment heading into this legislative session because it is the first session since Roe was overturned and elective abortion has been prohibited in our state. Yet we're facing new threats from the abortion industry. We have the abortion industry shipping and trafficking abortion pills into our state, and we have lawless district attorneys who are refusing to enforce duly enacted and passed pro-life laws. Yet the legislature ignored these new threats and didn't do anything to stop illegal abortions in our state. Another piece we advocate for is the Alternatives to Abortion program. This program is a statewide network of maternity homes and adoption agencies and pregnancy resource centers, and they help women choose life and thrive during pregnancy and for 3 years after the birth of their child, and they provide them with critical social services to help them do that. Now, we were pushing for this program to be fully funded at $200 million for the next 2 years, and initially the Texas House approved that. But after that, lawmakers walked that back to only $140 million for the next 2 years. Now, thanks to you contacting your elected officials and pushing them to increase that amount, they have increased the funding for the next 2 years to $165 million. And so thank you for reaching out and contacting your elected official, yet legislators still neglected to do their job of fully funding this program for the next 2 years. And this program is still necessary even though we have prohibited elective abortion in our state. It's needed now more than ever. And we see that because these providers have already seen an over 40% increase in demand for services since Roe was overturned last summer. Now, there's a couple other things I wanted to highlight for you. There were some reforms for pregnant and parenting college students passed this session. These are things like benefits to help them thrive in parenting and in their scholastic endeavors, and also to ensure and secure their rights on campus for pregnant and parenting students. The other piece I wanted to let you know about is that there were no weakening exceptions added to our pro-life laws this session. And this was something we were really concerned about heading into session was, will there be any weakening exceptions pushed or added? And they were not. And so we were grateful for that and thankful for that. Now, the other piece I wanted to let you know about is that there were significant reforms for vulnerable patients passed in this bill, House Bill 3162. It's the most significant bill reforming the Texas Advanced Directives Act and the 10-day rule to pass in the 20 years that we've been advocating on this policy. Now, this bill is the work of Representative Stephanie Klick. She worked with stakeholders to get everyone in the room and hammer out this compromise bill to reform this broken process. Under current Texas law, a hospital patient can have their life-sustaining treatment withdrawn against their medical decision-making with only 10 days notice and with complete immunity for the hospital. And so this reform bill helps provide more protections for vulnerable patients and their families. And there's a lot of different pieces. One of the ones I'll highlight for you is that it requires that a procedure be performed that would help facilitate a transfer for that patient to a different facility or a different physician that will honor their medical decision and have that procedure performed before any sort of countdown can start on withdrawing their treatment. And so we're so thankful to Stephanie Klick for pushing this reform. She's been working on this for decades, and so thankful to her for working on this legislation. And thank you for reaching out to your elected officials and encouraging them to get this bill across the finish line. And it has passed the House, the Senate, it's sent to the governor, and it will be enacted into law soon. And so I just wanted to give you this quick summary and thank you for contacting your elected officials on these various things and helping us hold them accountable to pass strong substantive legislation and continue holding them accountable to protect preborn children, to protect mothers, to protect vulnerable patients. And thank you for supporting our legislative team here at Texas Right to Life so that we can be in the Capitol advocating for strong pro-life policies. And so have a great Memorial Day. We'll give you more in-depth analysis on what happened during session soon, but we'll see you then.